Welcome to the Leukemia and Lymphoma Society of Canada's webcast called Surviving the Survivorship Issues, Moving Forward. This presentation is part of the Your Life After Cancer series. In this presentation, Dr. Esplen will discuss common survivorship issues and share ways to cope and move forward. My name is Sonia Muto. I'm the Community Program Coordinator for the Leukemia and Lymphoma Society of Canada. I will be the host of this online event. During this webcast, you will hear only my voice and the speaker's voice. The presentation will last approximately 45 minutes and will be followed by a 15-minute question and answer period. This presentation is also being recorded. Therefore, you will be able to listen to it again on our website while following along with the PowerPoint presentation. We will send you an email when the recording is made available. At the LLSC, we offer guidance and support to people affected by blood cancer every step of the way. We are happy to announce the launch of Your Life After Cancer program. We know that every cancer experience is unique and each step has a deeply personal meaning. For one person, life after cancer can mean letting go of things you can't control. For another, it's about managing physical and cognitive effects, or it is being present with their family. With time, survivors can find a new and more meaningful way of life, but may need support getting there. We are committed to building the tools and resources you may need to help you move forward after your blood cancer experience. Visit yourlifeaftercancer.ca for these new tools and resources. For example, you can review our new fact sheets on important topics such as adapting to cancer-related fatigue, managing brain fog, or supporting your loved one. You can also read, listen, or download stories of people who have experience with life after cancer or people who are managing a chronic blood cancer. Additionally, you can visit our new website to access multimedia resources such as webcast recordings and podcasts with experts in the field. For example, social worker Margot Kennedy shares insights on managing overwhelming feelings and stresses, or social worker C. Elizabeth Doherty presenting on searching for new meaning and finding a new normal. It is my pleasure to introduce our speaker today, Dr. Mary Jane Esplen. Dr. Esplen is a full professor and vice chair, Department of Psychiatry, Faculty of Medicine at the University of Toronto. She is a scientist and clinician at the University Health Network. She developed and is the inaugural executive director of the Souza Institute, University Health Network in Toronto, which is a knowledge translation center focusing on education for healthcare professionals in oncology and/or palliative care. Over to you, Dr. Esplen.
Okay, thank you, everybody. First of all, it's a pleasure to be able to do this, and I'm fairly familiar with technology, so that's technology allows us a wonderful opportunity to still have forums like this. And in fact, the Souza Institute, I think 95% of our programs are either multimodal or actually using virtual forums in our teaching or our programs for patients. So thank you for having me. And I'm delighted to be here. And I'm also really interested to learn more. And I've been very encouraged to see so many wonderful programs by this organization. I think that we'll be able to do some partnerships with your organization to even bring you more patient support programs. So I think it's wonderful what you're doing. I will say right off the bat that information and opportunities, even things like reading those stories and the podcast, these kinds of things that provide social support and decrease isolation, and just the provision of information alone is a way to provide psychosocial care, because when people are lacking in information or have conflicting information, it actually is associated with more anxiety and distress. Today, I'm going to speak about survivorship, and I have to say I've worked with different cancer populations, so a lot of my knowledge base will be from the field of psycho-oncology. That's really where I lean towards. That's where my research is situated. My own research has been either in cancer genetics with people who have family histories of cancer, or on coping interventions or interventions to support issues like body image and sexual functioning, and enhanced quality of life in some other areas. So I'm going to give you more or less an overview today. I know the survivorship literature in general. As you probably know, a lot of the research studies are done on multiple cancer populations as a group. There's a little bit in your area, which I'm also going to share. So anyway, survivorship is great in terms of today we're doing much better in all of the cancers with early diagnosis, multimodal therapies today improved for other types of cancers, improved surgeries. Not everybody likes the term survivor. I've done hundreds or thousands of support groups with different types of support groups with cancer patients and their families. And I have to say, not everybody likes that word, survivor. They didn't want to come here willingly and have to be a survivor. And it is a term that's used variably. But generally speaking, for today's purposes, and I was asked to speak around this area, it's really the time at the beginning of diagnosis forward, right till the very end of life, because it does have multiple phases, but because cancer survivors are surviving longer, there are many residual treatment impacts or types of symptoms that can continue on. And so we really think about cancer today more or less as a chronic disease. I'm going to focus on some of the key symptoms today. And I know in your patient population, maybe you see more weight loss. I'm used to working too with survivors who often have weight gain from some of the treatments. But whatever, changes like weight loss and hair, fatigue, we're going to talk about all these types of changes. They are associated with elements of distress, and it's normal to be sad or to be anxious and to have some of these feelings, because as I always say to patients, actually, everything we do, every single treatment we do changes one's body and person to some extent. So even though we're much better at promoting survival and treating cancers, pretty much all the treatments, and that includes surgeries today, they have an impact on the physical and other parts, emotional aspects of the body. So it is important to have programs to support patients and the family. And I think that anything, because this is very common, that sense of aloneness, there is an internal suffering really by everyone, whether they're able to talk about it or not. They do feel frightened, not aware of everything that's going to be happening to them. Pretty much would think not everybody would understand how they feel. And so even though social supports are very helpful, there is a part of this that would mean someone is suffering alone. That's why I'm a big proponent. I love group programs, but anything with therapists, peers, other patients, disease organizations like this one are really all important to help us take care of patients and their families, because this area is not just the patient alone. The patient and their partner or the family members are also going through it. The other thing that's really relevant, we'll talk a bit more about it later, is that people do want information. So you may find yourself looking up a lot of information all the time. And that can be very important to do, but it also can be overwhelming. And sometimes it's difficult to sort out information, what's accurate, what's valid, what's evidence-based, what's up to date even. But people do that because they're feeling out of control. So things that give us a sense of control when we've been impacted by something so kind of life-altering really is really helpful. But there is an element where you can feel overwhelmed, as you know, and feel a real sense of I'm not in control anymore of what's happening. And there is something I'm going to share. I often do, if you don't mind. And although he didn't have this type of cancer, I actually had a husband with cancer. So I've been in the system in another way. I've been there as a spouse for several years. And my husband actually did pass away. But I do understand going to clinics and follow-up care and what it's like from a more family point of view. And we also want to get control and information and so forth as well. Now, I'm going to go into some of the research literature and what we know. What I want to do today is share some things that I hope will be helpful, point you in the right direction. But let me tell you something, because one of the things I really want to do is to normalize reactions, because we know in all the cancer research that any periods of transition are a source of psychosocial distress. People vary in the amount, but it can cause surprise by feelings. One of the things that's quite common, which you may know about, is that when you end a treatment period, and you know, you don't have to go to the hospital as much and you don't have to see your health professionals so much, it can be very surprising and confusing because your expectations may not match how you're actually feeling. And you can very much feel grateful that you've done well, or but you may not necessarily always feel better because you may feel afraid. We know from research, patients have told us, it's a time of confusion. There can be a real sense of loss, which would be associated with sadness around that decreased contact with your health team, or receiving support maybe from a health provider that you were. And there are periods of psychological as well as social adjustment. It affects your relationships. It can affect your intimate relationships, your friendships even. So that sense of feeling abandoned, you can even feel unsafe because now all of a sudden you're not going to the hospital, and often unprepared. And we actually found out from the literature, you can see the quotations, the citations are back as far as 2006. Patients told us they didn't know what to expect next. They weren't receiving practical information and really were left hanging. And so can be a very distressing situation, and we heard from the patients. And that's over 10 years ago. Around that same time, there were two very important reports, and some of you will be familiar in Canada with the Canadian Partnership Against Cancer, which came much later. Around 2008 it was formed. They also have information on cancer survivorships, but these were some of the big documentations out of the US where there were very in-depth, evidence-based hearing from patients and family voices. That, you know, this whole phase after active treatment, people are feeling lost, confused, and need support. But look at the dates. It's 2006 and it's 2008, and I'm going to share some very recent Canadian data today. But you know, we need to do better. I know that patients are still falling between the cracks or left hanging. We can still build programs, but this is when it was really first recognized. And again, this is a sculpture that has been done, and actually it shows sadness and aloneness, but I do want to really underline, rather than pathologize, I want to make very clear that a lot of the reactions that happen are what I would consider normal responses given the situation, uncertain information, or people are frightened, or you're not sure what's happening, and just it's not even a new normal. It's just going forward into a future you don't know. A lot of living with uncertainty. Now, around that time, 2005, and I like to think about how do we, because I know you want to hear what do I do, and we're going to talk about the reactions and symptoms, but also what can I do? So this is a way to frame it. It's somewhat simple, but it's useful. First of all, and this is a psychologist in the US who has studied survivorship. And when we talk about in our field adaptive tasks, these are really these are things the person needs to do to cope. It's really about how do you adapt to a situation, whether it's a car accident or a cancer diagnosis or whatever life event has happened in your life. So one area to think about is your well-being, emotional functioning, and we're going to talk about that, things you can do. Another area is physical, and so you want to maximize opportunity for your physical functioning, because any rehab specialist will tell you, and I actually broke a hip last year, so I'm in rehab in a way, keeping active and keeping movement and working at your physical adaptation, no matter what your symptoms, is actually very vital to providing and maintaining your well-being. Interpersonal relationships, that's another area. That's part of our quality of life. That's in relation to our peers, our work relationships, our intimate relationships, and our family, and social supports like friends. This is an important area. And one of the things I know from many, many years of research is that social support, that's why I like groups. Social support is a buffer and can be very helpful in managing and preserving lower levels of distress in coping with life events or things like cancer. And there's research to support that. It also can boost your immune system, but it's a very important area of intervention. The other area is life perspective, and I put this on here. Dr. Stanton researched this as well. Life perspectives is really helping you manage with the new status quo, continued uncertainty, having priorities changed for you maybe, dealing with meaning, life purpose. These are important areas in terms of understanding what's happened that are also important to pay attention to and to work with. Now, I'm going to show you some stats because I didn't want you to take my word for it that some of these emotional and other types of concerns are very common. In case you are feeling isolated and alone. So emotional concerns have been reported. This is a recent, very large study on survivors, not just your area though, but it's published on the CPAC website for the patients as well, if you'd like to see the whole study. But emotional concerns are very common. We're going to talk about them in a minute. Physical concerns also very common. And these often have to do with the residual impacts, not just of the cancer, but sometimes the treatment impacts. So people that are receiving hormonal or people that have had chemo or other types of treatments, there can be residual impacts that you're needing to adjust to and work with. Practical concerns, also very common, and that would get into work-related issues, returning to your normal activities at home, maybe dealing roles and functioning at home with your families or at work. And interestingly, and this is very recent compared to the 2005 types of statistics, at least one unmet need. We still have work to do. Most people tell us that they're not having all their needs met. Now, it varies by people. The level of distress can vary. It has to do with so many things like severity of symptoms, age, social determinants like whether you live alone or not, your annual income, the geographic location, the services, and of course, factors associated with your individual treatments or your individual, which is very personal, the type of cancer that you have. Now, some research focuses on adults. Now we're starting to learn, and I do a lot of work in breast cancer and colorectal cancer around body image and sexual functioning, and I can tell you, it might not surprise you, younger adult survivors can be at higher risk for both psychosocial distress, emotional concerns, and other types of outcomes around physical health and well-being, quality of life. But again, this is another study. Dr. Jennifer Jones works at UHN. She's the head of our survivorship program at Princess Margaret. Again, majority of people are saying there's some overall physical and emotional concerns. In general, they're doing well, but and a lot of them, 61 say it's easy to cope with, but 44% found it easy to share worries or concerns with others. That means there's a whole group that aren't finding it easy to talk about. And in that study with Dr. Jones, here are some of the concerns that were expressed very specifically. Again, this is young adults. So this would be on the lower, usually ages between, I don't know, 16 or 18 up until they're maybe 30s. It depends how they define young adults. But this is, again, symptoms of depression and sadness, anxiety, especially fear of recurrence, very common. Also with adult populations, change in body image. Physical concerns, a big one for your population is that fatigue. And I will tell you that in all the research I see in psycho-oncology, fatigue is probably one of the top 1 or 2 symptoms we see over and over again. And we've been even trying to get our healthcare providers at the Souza Institute to know more around how to manage and work with fatigue. It's so common. But in your population, that will be a big symptom. Many patients have menopause, go into early menopause when they're young or have fertility challenges. And the other fairly common symptom with all the cancer populations, and this study, by the way, was not done just on your group of survivors. It was all the cancer survivor types. Cognitive changes, feelings and memories and cognitive function have changed, as well as, interestingly, sexual activity and intimacy. You can see the rate. So pretty high. These are common symptoms. And again, in the adult population study, fatigue, 68% reported. Sexual activity, about half. That means changes in activity. And for those single, often there's many, many important questions about, can I date? Should I date? Would anybody want me? Feelings, sometimes like people feel, have told me they feel like damaged goods, or just wanting to date but not knowing when to tell a potential new partner that they've had cancer. Changing concentration, again, this is the adult survivorship study. Anxiety, 69%, and again, body image, another significant factor. Now, this is a study that was not too long ago on your population type of individuals. And again, I've broken it down by what was reported in that study. So sexual issues are fairly common, medical and living kinds of expenses that you're probably talking to your social workers about sometimes, emotional difficulties. That's really managing anxiety, fear recurrence, depression, feeling alone, isolated, employment issues, health insurance issues. This study was done in the US, I think. I'm trying to remember what Perry is, I believe in the US. Childcare needs, family issues, often that's in the area of communication, difficulty with social and leisure activities. I do a lot of group therapy around body image and sexual functioning. And I think this one comes up a lot. Now, I'm often working with patients that have had a removal of an organ or a breast or something like that. But even when that's not there, people often cannot go back to activities they enjoyed, or they're hesitant to try them, or they feel they're embarrassed by how they look or feel and they can't go back to swimming or to running or to some of the things they used to really enjoy, including social outlets, including sexual intimacy, but also with peers. Cancer-related physical needs. So for yours, some of it might be lymph changes in your lymph system or fatigue, medical information, social support, getting support from friends. And I think one of the things that happens there is sometimes being surprised that maybe friends or networks weren't there as you might have thought, or different people were there and others weren't. So that's always interesting and can generate feelings of betrayal or disappointment and other types of feelings and feeling alone. And then spiritual needs is also a very important area in terms of not necessarily religiosity, but it may be to help with that meaning part, helping you to preserve that part of your quality of life as you go forward. This is an area I'm really interested in, and I started to get interested in working with individuals with a very strong family history of cancer who are at very high risk for cancer and then carry a mutation. But this has relevance for patients with cancer. I heard a lot about it in my support groups when I worked with primary breast cancer and also more advanced cancers. People can feel a shift in who they are when something extreme happens, like a cancer diagnosis, that is life-altering. You know, they're going on in life, like there's a continuity in our lives, and all of a sudden something interjects and shatters that. That can cause a change in priorities, a shift in inner values and what's important. It interjects a real sense of the finiteness of life. It's like an existential impact, really, that all of a sudden it becomes even more aware. Because usually before that, when we're younger, we have an invulnerability that we're going to be ill. But when that happens, there can be an impaired sense of that invulnerability, and that can be frightening. But it does affect self-esteem, confidence about your health or your future sense of yourself, and also shifts in identity. And I think this can play a role in people going back to work or going back to relationships or wanting to stay sometimes even in a marriage. Like there can be different kinds of ways that this plays out. Now, I'm interested in body image. Let me look at the time. I gotta watch. Okay, so these are, now body image, I would say every type of patient that goes through cancer has some sort of changes in their body image, because I define it quite broadly. But these are the types of changes that are documented in the literature. So change over your appearance, and that may be weight gain or loss, or other types of changes if you've had a functional change or even some surgery and other cancers. But and anxiety and sadness and grief over that. Changes in bodily function, that can be sexual functioning, that can be strength, that can be ways of you doing your daily activities, how things work for you, pain, swelling, lymphedema, all these things. Feelings of being less sexually attractive. And I told you that people have told me they can feel less attractive or like damaged goods or feel vulnerable and feel inhibited now sexually or being exposed and open. Uncomfortable in revealing clothes, which might prevent somebody from going swimming or doing something they previously enjoyed. Avoidance of leisure activities is fairly common. Avoidance of intimate relationships, and changes in feeling feminine or masculine, and distress over specific roles as maybe a mother, or roles you did in your work, or other roles that you may not have the energy for, or you feel you're not able to carry out in the same way. Now, this is really kind of a framework. These are just to show you changes in body image are not just physical. It's perceptions and how one feels inside. It's self-consciousness. And it can really play out in self-esteem and that self-identity piece, and how people can feel in terms of confidence around themselves as a person. So it's really your attitude about your physical person, your appearance, your general wholeness sense, like people feeling whole or not, your ability to function, and your sexuality. And this is another recent model published. This is really in the health professional literature and research, but you know, I'll just say something that people forget. Who you were going into cancer. I see this play out all the time when I do psychological treatments. We really examine this. Who were you coming into the cancer experience? How did you think about your body and yourself? How much did you internalize societal kinds of messages, like how women are supposed to look, or men are supposed to be, or weight, or what's valued as an idealized person, or what roles you carry? The whole history of the body, and your body in terms of its interactions as a social being, is really entangled in this, so that when cancer comes along and the treatments and the impacts, these are all important things, and I think about them a lot when we design treatments. So it's not just about the cancer, it's the person coming in, and how your culture and your backgrounds, including, we know that people that have had a prior background with mental health or any kind of challenge in the past, or trauma, like whether it's physical or emotional or sexual abuse, that's just a plague. It doesn't mean for sure you'll have more difficulty, but I always remind people it is a plague that you might need and benefit from added support. And again, this is just a young man worried about a partner rejecting him, not feeling like he could perform like he could previously, just not feeling confident about his person. Now, sexual functioning, gotta look at the time, I'm just taking a quick look, yeah. So sexual functioning is interesting too, because not everybody wants to talk about it. And let me tell you something, because I'm so involved with health provider education. We run 2 and about to be 3 courses on training nurses, psychologists, social workers, and others. And this is in partnership with the Canadian Association of Psycho-Oncology. And I'm delighted to promote this because it's so important to our well-being. We actually are trying to teach health providers in your general clinics to know more than they do about sexual functioning and how to ask about that. Because I know the patients are telling me they're a bit afraid to bring up things like body image and sexual functioning. They're more intimate, they're more private. And one of the things I think is a fairly common response that patients tell me anyway, they really are grateful that they're alive and they're doing okay. And they don't think that these things, they don't want to be perceived as vain, or they're thinking that this can't come up in the clinic. But we're trying to do better on this. And I would really advocate that if you are suffering or finding changes, or, you know, the sooner you deal with these particular set of items and issues, the better for your chances to keep going forward with them. This is an important part of your life. If you're in a relationship, and those for you of you single, you don't know what's ahead. I can tell you, even in my advanced cancer patient groups, where people were with a very primary advanced cancer, I had a couple of people that met people and got married. So we don't know what's really ahead, but people can feel very blocked and very withdrawn. So your sexual functioning has to do with your physical part of your body, but very much psychological. So how you think about yourself, your self-esteem, your view of your attractiveness, these are things we can work on in care. But these interact with your ability to respond in an intimate situation. Because if you're thinking you're unattractive, or you're ugly, or nobody's going to want you, you're not going to be able to enjoy sexual activity, and you're not going to be able to be relaxed enough to really even do it in the way you're used to doing it. Relationships, there's a lot there about communication, open communication, bringing things out. And I know that spouses go through a lot, and sometimes they're not talking to each other, and it's very tricky to talk about each other. And also spouses can often feel they're afraid of hurting their partner with cancer. And I have to say, you know, my husband and I were in clinics a long time. You know, I was in a partnership, and it's not always easy, but open discussions are just really useful, and there are ways to get help with that in the system. Social cultural influences, also your beliefs, your culture, how you view masculinity, what you value in your physical attributes. These will intercede how you respond to this area. So, and there's all kinds of different types of struggles. Now, I'm going to move the last part of this talk, and I know we need to leave time for questions. I've talked a lot about the common reactions and the symptoms, which, you know, many of you probably know, but I just wanted you to see the research so that you know they're to be expected and they're common. And you shouldn't have to feel so alone if you do, and that we actually do have psychosocial oncology services. And we are learning a lot in research. We have many randomized clinical trials now in the field of psycho-oncology, I would say 3 decades of excellent work, not always in the survivorship area and not always in your specific area of survivorship, but we have a pretty good idea now what to do with each of those, you know, problems I mapped out. So it's something to reflect about. There, you know, the thing about COVID, I haven't even acknowledged that, but I'm going to come to that at the end, because we're offering a support group to any patient with cancer that intersects with the COVID to help you cope with COVID and all that's happening. You know, with technology and virtual care, you're going to see more psycho-oncology services in the next year go online virtually. And for those of you in rural populations, that's probably an opportunity to have more opportunities to connect and get help. But I'm going to tell you a little bit about the research as I understand it, and I know there's some excellent work being done. So there are things you can do, and I think it's important that you know that. First of all, I'm hoping after, if nothing else today, I hope you know, if you didn't know, that it's natural. Many of your feelings are natural. You don't necessarily want to keep suffering like this long term, and you may not have to, and we want to make sure you don't. So it is important to let people know how you're feeling. And there's no way that I think people can get through cancer without having some of these reactions. Now, let's think about it as a whole. First of all, let's go back to Dr. Stanton's thinking about the emotional, the physical, the light, and the interpersonal. So anything, you want to strengthen your resilience. You know, each of you will have your own personal story and your own personal going forward in terms of how your disease plays out, how the treatments play out, how everything plays out. So anything you can do to help you in your psychological preparation will be helpful. One of them is information, which is why this organization partly exists, I think. It's really helpful. If you think you don't have clear information, then try to do something for yourself and get it, because that will help a lot. I think we're working better in the field at tailoring information. So the more tailored it is, and I'm sure you can probably tell me more than I can tell you, that a lot of information is on breast cancer and prostate cancer. I think because those organizations were around a long time and a lot of studies, I have to say in psycho-oncology, we've done more psychosocial intervention studies on those populations. They're big populations, and they seem to be the early ones studied. However, more is coming, and I will tell you, having worked with different types of patients, a lot of the survivorship types of challenges overlap, and so the approaches can actually work with groups of mixed populations or an individual treatment. If you can find a psychologist or social worker or coach who is working with different cancer patients, that also might work very well. Anything that gives you emotional insight can be helpful to understand what you're feeling, so you're not left alone and confused. Like, try to, whether it's journaling or go see some, get a sense of what you're actually experiencing. Things that help you with wellness and life balance. That's everything from work and expectations, overdoing things, but also pushing yourself. Rehab is very important to have some motivation because it will help you, even though it may be hard, in your going forward. Spirituality is really important for that reflection and life meaning part, and having a way to make sense of all this. Like, why is this happening? How come, these kind of big questions that happen. Things that personally help you reflect, journaling and meditation, anything. If it's exercise, for some people it is a bit of exercise or walking, they reflect more then. Whatever helps you facilitate, because these are the things that help you with that continuity of self. So think about it like you're on an escalator. I think about an escalator all the time, and I've been on that escalator as a partner. And you think, wow, like it hits you like life's over. Like you just think, well, now what? Like you really don't know where things are going. But the thing about escalators, they keep moving and they have a way of taking you along. So anything you can do to facilitate and poke that continuity of the self will be helpful, because life is going to go on. Like, I mean, the journey, like you will get up, like, there will be you get up and you do with going to the next day. And so the best you can do is, where are you on that escalator now? Where am I now? What's important to me now? Trying to live in the moment and keep trying to live and go with the continuity. Now, here's some programs that are all evidence-based. There's research on every one of these models. And I know I didn't put citations, but they're easy to find in the literature. The most, probably the most, perhaps one of the most researched areas is cognitive behavioral therapy. And that is for so many things. There are cognitive behavioral types of, and there are all kinds of modes, in person and telephone and now online, like iHealth, like technology-based CBT. So these programs are helpful for anxiety, for fear recurrence. They're helpful for managing depression. They're helpful for improving coping. There are some good cognitive behavioral programs that have been tested for body image and sexual functioning, because cognitive behavioral programs try to change and help you understand your thinking and cognitions and how you're responding according to that. So there's a lot of reflection in these treatments, but also some tasks and some exercises to help you develop more adaptive cognitions that will help you in your coping and then your ability to go forward. So there are many different things. They're good in groups, and there are one-to-one cognitive therapists. Exercise, I can't even, I think they're trying to get all the physicians to have like a notepad, because exercise is turning out, and it's not to me so much about, are you a jogger or aerobics or whatever. I mean, all that's excellent. I mean, of course, aerobics are excellent. Moving, get yourself moving. Exercise has been associated with better prognosis, with coping, with mood, and even with prevention. And sometimes exercise programs are combined with a cognitive behavioral therapy. It is one of the best things for sexual functioning, for body image, and many areas of where there are symptoms. Wellness and nutrition, I won't go into that, but a lot of the wellness programs and Wellspring, and there are many things out there. But basically, taking care of your nutrition and your well-being physical part, now that's the physical part, is really going to be important to your emotional health. Otherwise, you're not going to have extra energy. You're not going to be able to do and kind of keep adapting and do what you need to do. And so CBT has been done. There's some programs sometimes that do CBT and exercise. Self-help and coping, self-management, there'll be a lot of things more and more online, but there's a lot, self-management, things you can do for yourself, sometimes with a coach or a therapist that will guide you. Those programs, everything from coping to gaining information to even couple interventions now, those have been associated with really good outcomes on mood, on quality of life, and in managing symptoms. So managing fatigue, managing sleep issues like insomnia, pain, managing fear, these kinds of things. There's many self-help and self-management online programs now. Stress reduction, everything from guided imagery to relaxation to mindfulness meditation. They're good for reflection. They really help you live in the now, and they really help with symptoms. So we know that these things help with pain, coping, depression, anxiety, and sleep. And those are some of the main symptoms reported in survivorship. There are many randomized trials. There are ongoing mindfulness programs that are being trialed, and there are many that you can even get online now. So ask your cancer programs about them. I'm a big proponent of support groups, and sometimes people go, well, don't go, it breeds misery. It doesn't. If you know, I'm a proponent really of therapist-led group programs, because that's where you can talk openly and in a safe way all the things you're frightened about, all the things that are coming to mind at night when you're alone sleeping, all those things. And you can also in groups bring in guided imagery or meditation techniques. You can teach active coping. So there are many, many models, but I know that not all support programs in your jurisdiction may have in-person groups. Right now, they're not happening because of COVID, but I will let you know that we probably are partnering with this organization. I've got the very last of my, I have to watch the slide, the very last of my slides, I have a Cancer Chat Canada. You'll see the website. We offer at no cost therapist-led, text-based support groups across Canada. And we have groups on art therapy and coping and sleep and pain. We've had groups, I'm doing right now, one on body image and sexual functioning. So that's another way. We bring 10 or 12 patients together who have had cancer, and we work on, you know, there's different models that we do and we advertise them. So get yourself registered, and don't be afraid to come into some of the mixed groups, but I think we're going to be talking to your organization to offer something tailored for you. Couple counseling. And I know, you know, the thing about cancer, people that have had cancer, they haven't maybe had a mental health issue in the past, or haven't been opening to counseling or psychotherapy. And I think it's incredibly helpful. I actually had a therapist all the way through dealing with my husband's illness, and then after, when he passed away. It was so helpful to me. I really believe in this. I do it. And I know couple and individual counseling, there have been trials on both. So individual cognitive behavioral or psychodynamic therapies, or therapies that focus on existential issues, like there's a calm program, there's meaning-making programs around grief, there are family-based counseling programs. So there are programs around if you ask, or even getting a social worker in the community to work on couple counseling with you, to help a neutral person coming in to open things up, help guide you both as a couple, and help you illuminate what's happening and where there's some challenges. Family therapy is another one, especially with young patients or children, young parents with children. There can be communication challenges and changes in the roles at home that causes a lot of stress on the family. And then medication, for some, there's a higher number. So we know that it depends on the study, but 25 to up to 75% can have a significant psychological symptom like a depression or anxiety at some point during their cancer trajectory. Now, a smaller group, around 10 to 20%, will have higher levels of depression or anxiety that really requires more than just therapy. And they really would benefit from some medication to help them. They're not sleeping, they're suffering a lot, and there is help there. And if you don't know where to go, ask your cancer program for a referral or your family doctor. Now, self-management, I won't spend any time on this. Self-management to me is everything from websites to coaches online to behavioral types of decision aids, all kinds of things. They're mainly online. You can look them up. Sexual functioning. This is, I have to watch the time. I'm getting near the end. Sexual functioning and well-being. This is just really from one of my teaching seminars. But I just want to show you in terms of the this is a model that's been published in the literature, but it's called the Plicit model. But really what it talks about is, first of all, you have to give yourself, and we as health professionals have to give the patient and the couple permission to open this up, because it's a really sensitive, tough topic sometimes. And I find that patients and families have very limited information, as do health providers. But now more cancer programs are developing sexual rehab clinics. And so ask about that. If you're in a larger center, there may be one. And there's more and more coming online. But they will be very helpful for specific, there's a group of, most people just need to be opening this up and having topics and knowing what to do and how to handle some of the symptoms and changes to your bodies. Some will require and will really benefit from a sexual health couple counselor, or someone really, and that's a smaller group, but really benefit learning on technique, learning about communication, learning on things they can do to work with some of the changes in their bodies. Eating, exercise, eating and healthy, all that kind of stuff is really important. I wouldn't underline, it's very important for the maintenance of your long-term health. And one other big area. Now, I will tell you, I should put it on my last slide. Look up the Return to Work website. Christine Mahou and Maureen Parkinson out of UBC. Christine's at McGill. And our team helped build this at the beginning, and now they've taken it over. This is an online website just on return to work, has resources and all kinds of things. So the whole issue of returning to work is complex for the person with cancer, the employer, and the coworker. It's really complex for everybody in terms of the outcomes. Most of the interventions in the research are multidisciplinary, and people are starting to research this. We know that it's a significant issue, and I think it wasn't talked about in the early days, but it is now. So most of the programs have a psychosocial psychiatry component, an educational, like things you can do to help you get ready to go back to work component, and physical exercise, again, is very helpful. The only thing is with these multidimensional programs in the literature, we don't know which thing works best. And I think it's quite individual, and that's why I like this website that Christine and Maureen have built. But psychosocial interventions can have a positive impact. So probably more than one type of way to come at this issue is important, because you need information. You need to know what your agency will do for you, what you need to know about going back and how much you should go back. Educational training can be really important. Counseling to the person, whether it's in a group or just getting support about that readiness. I think some of that shift in identity plays a role in feeling ready to go back to work. And it would make sense to me, you're going to feel less confident and unsure, and even what to tell colleagues. And people might ask questions. You may think people will look at you differently. You may not feel ready to go back. So all these things are important to talk about. And then accompanied by physical rehab, exercise, and ways to strengthen your physical self. It can be, we know from research, on the job support, so working with occupational health, having a supportive environment obviously is going to be helpful. Sometimes accommodations can be put and need to be put in order. It's an area we still need to study, but I should have put it on the last slide and I forgot, but it's called Return to Work. Just look it up and Google it. You should be able to find the website. This is something underestimated. This is something I tell people all the time. Actually helping others can be really important. People do want to give back, and sometimes they are volunteers or they co-lead groups or whatever. This actually is very helpful to the person receiving the support, but also to the person providing it. Helping and doing things, giving back, is actually a very good coping strategy. So I'm at my last slide, so now we have time for questions. This is how I think of it, that you want to get to. And sometimes you get there on your own, and sometimes you can nudge it along, but this is where you can have control. There are many areas you may not have control, and control can be really hard to let go, and that's why cognitive behavioral and coping strategies are important. But when you can relinquish it a little more than you're used to, focusing on the now, this is why meditation is so helpful. Living life as best you can now with hope, realistic hope, and all that can be helpful, because this is where you want to get. You don't know what's ahead, but and the cancer hasn't taken everything away, possibly. So really learning more about what it hasn't taken away and who you are now as you go forward. This is really kind of the goal, I think, is trying to take advantage of what you can do now and where you're at now, and try to enjoy and have quality of life. So I'm going to stop there. I know there's slides of a few questions you sent in. I think I'm getting a bit over, but I'll stop there. But thank you so much again, and I do wish all of you well. Try to come to Cancer Chat Canada if you think that would be helpful. I put the information at the bottom of the slide.
Thank you so much, Dr. Esplen, for sharing your expertise and your knowledge with us today. That was extremely interesting, and I was very appreciative of that. Thank you. So you are right, it is time for our question and answer period. And at the time of registration, we asked for your questions. So although we cannot answer all of these questions, we were able to choose some questions that we felt would be able to answer most of the inquiries in general. So if we can move to the next slide, we'll see the first question. After 3 years of being in remission, my energy is often inconsistent. Is there a reason why this is?
Well, first of all, it's really hard for me. Like, this is a very specific question. I think fatigue and energy is definitely one of the more common symptoms of your group. And I think usually when we even look at insomnia, cognitive, and fatigue, it's multiple factors usually, including psychological. This stuff can wear you out, like coping and stress can wear you out. So it really depends. However, the only advice I could say is, so some of the things I talked about, like exercise and trying to do something for yourself and social support, those things will help. And of course, nutrition. But, and if you don't know what to do, you can always get a consultant with a nutritionist. However, you do need to monitor your energy, because if you see changes, it's like any patient with cancer going forward. You know, the flu can frighten it. Like they don't know sometimes, is it the flu or what do I have or what? And so monitor it and try not to panic each time. But if you see a more extreme change or something lasting longer than a normal amount of time, 2 or 3 weeks, then it's something to go to your doctor about. And you're going to have to, part of going forward for this group would be monitoring your energy and specifically watching for more extreme changes. But there isn't one reason. I don't think there ever is really one reason for energy and fatigue. I think it can be quite multiple factored.
Thank you. So we'll move on to question number 2. How do I move past triggers and fears? I go in the shower and still protect a pick that line that isn't there, or fear making long-term plans.
Yeah, this is a common one. This has to do with the fear of recurrence and also the triggers. It reminds me of people going in for chemotherapy sometimes after they've been sick once or twice. Just thinking of going in there can make them actually throw up or nauseous. It's sort of an anticipatory response. So this is where cognitive therapy, cognitive behavioral therapy can be helpful. I think in time it should dissipate, but I think the meditation, mindfulness, first of all, acknowledging it like you've done that, but I think doing an exercise going in before you go into the shower might be good. The fear of making long-term plans really has to do with the fear of recurrence and getting yourself to turn off some of those thoughts enough that you can live in the here and now, because it's to do with not having control. That's really what it's about, the fear of not having control. You don't know what's ahead, but there's realistic hope. Like, you should be able to make some plans, right? You should still have hope and try to make long-term plans that are realistic, but with the caveat that you never know what's ahead. But when fear and anxiety gets the best of you, if it's really high levels, it's not dissipating, and relaxation therapies or doing something before you go into the shower, you can't turn those thoughts off, I would think that you need to go and do one of the fear recurrence programs, or see if we have one running at Cancer Chat Canada. Sometimes we do, or go talk to a therapist and get some training in turning and managing those thoughts. It's your own cognitions that are driving the reactions. They're understandable, but they can really impact on your quality of life. And then it takes away from living in the moment and your relationships and being with kids and family and whatever work. So there is something you can do about that, though. There are fear recurrence programs.
Thank you. So question 3, what to eat to stay healthy? I also live on a farm. Should I be worried about dust or animal dander?
I'm from a farm. I wouldn't be worried about the farm too much. I don't know if I should say that, but I think the farm is a great place in many ways, because it's in many ways so beautiful there. I'd be careful. All of you need to be careful. Eating healthy, I'm not a nutritionist. And I work a lot with physicians and doctors, and we don't all eat well. You can get lots of information on how to stay healthy and what to eat. On the other hand, because I've worked in eating disorders in other areas, I think you should enjoy life, and treats and having foods that you enjoy that aren't always the healthiest, you should enjoy. Why not? Like, you don't know what's ahead. You should enjoy now also and balance it. Alcohol is something to pay attention to. Be careful about alcohol. I think it's okay, but I mean, again, you need to monitor like a healthy level. But the farm thing, I don't know what to say. I actually wouldn't worry too much about the whole animal thing. I think being around animals is kind of nurturing and therapeutic. But I'm probably not the best one to answer that. But I wouldn't worry about that, actually. Just take care of yourself, you know, dress, wash your hands, all those kinds of things.
Thank you. So question number 4, if I participate in a clinical trial and it is not successful, can I go back to what works without any downsides?
That is a really specific question, and how I would handle that is, I don't see why not, but you need to talk to your physician, because some of the clinical trials, and I don't know your area enough to know what trial you might be referring to, but it's a kind of, but do not hesitate to talk to your health provider team. That's how I would handle it. And it's just like when you're examining a clinical trial, you should ask the questions you have, ask about the level of evidence, and make sure you know when it's not working so that you can switch back to something that might have worked for you. So that is a question for your nurse and your physician, your treating team. I think mostly you can, but it might depend on the actual clinical trial and your current health, of course, like your health state.
Thank you. Question number 5, how do you balance between optimism and realism when setting personal expectations?
A really good question. I would encourage optimism, and I believe, like, if you know, okay, so we know with coping styles, I think we all vary on that. Some of us are more catastrophizing kind of thinkers. Coping style does vary, and optimism and different coping styles, by the way, are associated with different psychological reactions and outcomes. Optimism's in your favor if you happen to have a lot of it. Too much of it, though, like if you're too optimistic to the point where you're not really in touch with what's really happening. And like one clear example to me is if people are so positive all the time, they can't really assess properly the current situation, which might prevent open discussions when someone's advancing in their illness. And I know we're not here to talk about palliative care, but I really believe in quality palliative care, and I had it in my home. And my conversations with my husband were worth a lot. And if I was so positive and optimistic all the time to the point where I wouldn't be able to see what's really happening, we wouldn't have been able to do some things we did in the last few months and enjoy life as we did, and open things up with children and so forth. So I think there does need to be a balance, but I'll tell you, if you're a negative coper, sometimes seeing a therapist can help you with that. Cognitive behavioral therapy, meditation, and or psychodynamic therapy to understand more about that coping style, because this is your investment. Your coping style is your tool in terms of your adaptation and how you deal with all this that's been thrown at you, which is not fair. I mean, it's not fair to even have to have cancer. Realism is about getting information, trying to understand clearly what it means, asking about trials, asking about stats, but understanding they're a whole. That doesn't mean that the stat will be, you know, there's always the individual. So you do want to do things that serve you well, allow you to get up in the morning and have the best possible day. And even in advanced cancers, we tell people it may be the hope for that day. It may be hope not to have a pain-free day to do something. It may be hope to have something that you could achieve, like your goals may need to be smaller. But if you're not in an advanced level of cancer, you know, trying to plan and be motivated, that's part of enjoying life. Maybe you want to try a new job. Maybe you're going to, you know, go on some vacations. I think those things are very important to enhance the quality of your life and to manage psychological reactions. Because what you have now is what the cancer didn't take away. Your relationships, or your goals around relationships, or your needs now, your quality of life. That's what you have. It didn't take everything. So the next question is around guilt.
Yeah, question number 6. How do I get around the guilt about being less productive, not going back to work, etc.?
I deal a lot with this one. Well, we vary in that. I think people vary in where guilt comes from. I believe it comes a lot from backgrounds and cultures and many, many things. It's to be expected, especially with high performers who are used to being productive. You can feel really guilty about not pulling your weight. And that's a very harsh stance on yourself. That's a real harsh way of kind of beating yourself down. And you've dealt with enough, right? So that can be worked on again in therapies or group therapies. And we have this come up a lot in our group psychosocial supports. And I think it's very common with people that enjoy their work and are very highly productive and have very high expectations. Sometimes people are perfectionists and the expectations are not realistic. But I do say, and these return to work programs would be helpful. Go and look up that website. But understanding what's realistic, like you do need to see and understand your body now as it's healing. It will keep probably growing, but understand what you can do now. I've had to kind of go through a bit of this year with my hip. It's a struggle for those of you who are used to, and part of that comes from if you've been a performer and a high proficient person, it sometimes feeds your self-esteem. And so when you can't do what you used to do, that can also decrease your self-esteem. So it's something that can be worked on, and you need to talk about it. It's a good question. Ongoing problems, I don't know about this one if I can. I think some of them are mainly fatigue with CLL and the uncertainty, continued uncertainty going forward, wondering what's ahead. I'm not sure I will know sometimes the issues with spleen and so forth, but I think again, it can be very individual. Fatigue would be a big one in energy. Then 8, I would appreciate, the watch and wait. Oh, okay. Yeah, the watch and wait prior to treatment is one of the more stressful times when you're not in treatment too. You know, going for those results and being monitored. This is a very stressful period. I would suggest the best way to do this, what you want to do here is build skill in managing anxiety, because uncertainty and watching and waiting can be associated with higher levels of distress. So relaxation, cognitive behavioral therapy, meditation, mindfulness, ways to be able to stay with the way you are now, like to just kind of wait. You want to be able to modulate and manage your emotional reactions and it's mainly anxiety in this situation and fear. Okay.
Yep. Thank you so much. So that's the end of our question and answer period. We would like to thank everyone for watching our webcast today. Please visit our website to register for upcoming webcasts. For example, Survivor and Caregiver Burnout on Saturday, June 6th at 1:30 p.m. Atlantic time, or COVID-19 Conversation with a Hematologist on Thursday, June 18th at 10 a.m. Pacific time. We would also like to thank CIBC, our national sponsor, for the Your Life After Cancer program. Thank you very much. And last but not least, I would just like to remind everyone to visit yourlifeaftercancer.ca for more resources. Please do not hesitate to contact your community services manager for support at each step of your blood cancer experience. I'd like to remind everyone that a short survey will be sent to all participants after this webcast. We would greatly appreciate you taking a moment to fill it in, as it would really help us to offer you the most valuable information in the near future. So thank you, Dr. Esplen, for joining us today. Thank you to everyone else. Have a wonderful day and stay safe, everyone.
And thank you again for having me. I hope that's been helpful. And, you know, do visit Cancer Chat Canada or look at CPAC. There might be some resources there, Canadian Partnership Against Cancer as well.
Thank you so much. Have a great day, everyone.
Thank you. All the best.